The Padma Awards, among India's highest civilian honours, were announced on the eve of Republic Day 2026, recognizing exceptional service across a wide range of fields, including art, social work, public affairs, science, sports, and civil service. This year, the President has approved the conferment of 131 Padma Awards, including 5 Padma Vibhushan, 13 Padma Bhushan, and 113 Padma Shri Awards. The Padma Vibhushan is given for exceptional and distinguished service, the Padma Bhushan for distinguished service of a higher order, and the Padma Shri for distinguished service in any field. Among the Padma Vibhushan awardees are former Kerala Chief Minister V.S. Achuthanandan and veteran actor Dharmendra, both honoured posthumously for their contributions to public life and the arts. A key highlight this year is a recognition of 45 unsung heroes, with the Padma Shri celebrating extraordinary Indians making extraordinary contributions at the grassroots level. Notable among them are Anke Gowda, who founded the world's largest free access library, Pustak Mane, and Armida Fernandez from Maharashtra. The highest number of awardees this year are from Maharashtra, followed by Tamil Nadu, Uttar Pradesh, West Bengal, and Kerala, reflecting the diversity of excellence across the country. Now, Padma Shri 2026 awardee Dr. Shyam Sundar Agarwal is being recognized for his pioneering contribution to medicine, particularly in the fight against Kala Azar, a deadly disease that has long affected parts of Bihar and eastern Uttar Pradesh. Originally from Muzaffarpur in Bihar and professor at Banaras Hindu University in Varanasi, Dr. Agarwal dedicated over 4 decades to developing affordable and accessible solutions for communities most vulnerable to this disease. He developed a rapid diagnostic test that delivers results in just 10 minutes, sharply reducing costs and enabling early detection even in the most remote areas. He also played a key role in creating a single-dose oral treatment for Kala Azar, which replaced prolonged and painful injections and cut hospital stays for just 24 hours. These innovations were later adopted not only in India but also in neighboring countries like Nepal and Bangladesh. Through sustained research and field work, Dr. Agarwal's efforts have helped nearly eradicate Kala Azar in several regions, saving thousands of lives and transforming public health outcomes. And we have Dr. Agarwal joining us here on News9. Dr. Agarwal, thank you so much for taking time out to be with us. First of all, many congratulations. We are honored and privileged to be speaking to you on this momentous occasion. It's been a lifetime of work, contributions that is going to endure for many generations to come. I want to begin by asking your thoughts at this stage. How does it feel to be conferred with the Padma Award this year in 2026?
First of all, I like to make a little correction because I don't use my title officially, so I write only Shyam Sundar, not Shyam Sundar Agarwal.
Okay.
I don't mind, but
Fair enough.
I wanted to correct yourself.
Okay, Dr. Shyam Sundar, let me reframe that question for you.
Anyway, you had asked how do you feel. Any award gives you a pleasure and gives an incentive to work more and more. And I'm not trying to boast, but I think every time I've been awarded, I felt that I should work more. This is not enough. And today also, even after we have achieved the elimination target of Kala Azar elimination program in India, I feel the work is not yet done. There are many more things to be done.
Okay.
And of course, I feel very happy. No problem. No, I mean, I don't say that. I'm really very happy.
How did this journey begin for you? Your war against Kala Azar. What was that moment of inspiration for you to take this up as your main cause?
Well, I think it's very easy for me to answer because I was born in Muzaffarpur, Bihar, as you have rightly said.
Okay.
And Muzaffarpur, if I'll not be very off target to say that it was the capital of Kalazar in India, in fact, that area north of Bihar, Muzaffarpur, Darbhanga, Sitamarhi, Samastipur, Chhapra, Hajipur, all these districts were heavily affected by this disease, this deadly disease. And so, it was very natural when, of course, I wanted to become a cardiologist. I mean, as any young physician, you when you go for medical studies, and then earlier I used to remember look at the boards of the other doctors, and they used to write physician and cardiologist. So that was my desire to become a cardiologist. But when I after my education at MBBS and MD at BH Banaras Hindu University, I joined almost within 2 weeks as a lecturer in the Department of Medicine. And I wanted to do cardiology. Then when I used to go home, I always used to read newspapers heavily infested with the news that thousands of people are dying and no drugs, no proper drugs, no diagnosis. And diagnosis was very, I should say, quite delayed, because you have to demonstrate the parasite using the bone marrow or the splenic aspirate. Bone marrow was not efficient, only 50 to 60% could be diagnosed, whereas splenic aspirate, though very efficient, more than 95% sensitivity, but it was very dangerous. You could kill a person um, because by causing it, its spleen became big and soft, and once you put the needle inside, you have to really be a real expert to do that. Otherwise, you can tear the spleen, and the patient will die because of intra-abdominal bleeding. The only treatment is that you have to remove the splenectomy, which you can well understand is not possible within a few minutes or within an hour, even in the biggest city of the country. What to talk of at that time, I won't say today, but at that time, very poor medical facility, which was there in Bihar, and especially in North Bihar in Muzaffarpur.
Okay.
So, go ahead.
Fair enough. And I'd like you to finish your point, actually. I think you were taking a pause and I interrupted. Please continue. Dr. Shyam Sundar, where I wanted to ask was that, clearly, what you saw at that stage, inspired you into taking up this fight against Kala Azar. When, according to you, you think that you ended up, what was that moment when you thought you ended up, my mission has been accomplished, we have beaten Kala Azar?
Well, I would not say my mission is accomplished.
Okay.
It is not yet.
No, but there are several
Though we have
regions where this has been
achieved the
eradicated.
elimination. No. Yes, eradication is different.
Okay.
And this is, elimination is different.
Okay.
It is in a different sense. Elimination as a public health problem, as the WHO has defined, or as we have formulated the words. This is only the target that has been achieved with having the number of patients less than 1 per 10,000, and removing taking out the level of public health problem. But still, there is a lot of thing to be done, and there are lurking dangers of a restart of epidemic if we forget to take forward steps. Then I may not be alive to live, but I can tell you in another 10 to 15 years, we will have another epidemic. So the work is not yet done.
You've played a key role in creating that single-dose oral treatment for Kala Azar. Such innovations have been later adopted, across the world in neighboring countries as well. What was, going through your mind when you saw the fact that was something that you've invented right here on Indian soil is something that's being adopted globally?
First of all, again, I like to correct you. It is not single-dose oral. It is single-dose infusion. It's an injection.
Okay.
You have to do that.
Okay.
If you recall, I mean, if you are given prescribed a drug, you have a common cold or whatever, I mean, little infection, you are prescribed an antibiotic for 7 days, and when it is 3-4 days you feel better, then you forget to take the entire thing, entire 7 days. That's very usual. And so, although we earlier, in fact, my team discovered miltefosine, which was a capsule, which was the first oral drug, in fact, in the world against leishmaniasis. We have to give this drug for 28 days. It had other problems. I mean, I don't want to go into those details.
Okay.
Because it had a bad effect on fetus. So patient could not be given to the pregnant women, as well as patient should not have become pregnant, or was not allowed to become pregnant for next 3 to 5 months. So, and this drug has to be given for 28 days, though it was the first oral drug, as I said. But my dream was that to shrink the treatment duration as much as possible. And it took me 10 years, almost 10 years, when we started our journey for this, as you have said, single dose infusion.
Yeah.
Actually, when we started working on amphotericin B lipid compounds, amphotericin B itself is a very obnoxious drug, very toxic drug.
Yeah.
It was used in Bihar because it has an excellent efficacy, almost 100%. But the point was that the patient has to be in the hospital for 1 month, more than a month, 5 weeks. And you have, say, 20 beds or 40 beds, you can treat only 40 patients in a month. And the load was several lakhs, 500,000 patients were there at some time. So really, it was painful, and the treatment was very expensive. So
right.
These poor patients, this disease is poorest of poor, so they just could not afford it. Okay. So they were dying in thousands. So my mission was that. So forget about that. So I wanted to compress the treatment.
And you reduced it to 24 hours.
As little as possible. So. Yeah, not 24 hours, even 2 hours.
The hospital stays have been reduced to just 24 hours. Fair enough. The treatment is for 2 hours.
24 to 36 hours. Yes, you are right.
Fair enough.
Hospital stay.
Fair enough.
So we worked on this. We used various regimens. I think we did 20-25 trials over the period of 10 years. Published them. And ultimately, I'm sorry, say that again.
And then it went global, sir. So, it is a moment of pride that, an invention right over here in Bihar went global and got adopted by other countries as well. I'm afraid we're out of time here on this conversation, Dr. Shyam Sundar. Thank you so much for taking time out to be with us here.